Hari, Vandelaar, si Susie Vanessa, si Interim Health Manager, Leslie. Hello, good morning. I'm Vanessa Vandelaar and I'm the Interim Health Manager. I apologize that I have to wear a mask, just feeling a little unwell and my voice might sound a little funny. So I started working for the band office the health center since June, the end of June. So you might have first seen me start engaging with everyone during the health fair. So I was really happy to host that within our community, and we had a really great turnout. So I'm really happy to be here today. A little bit about me. I was born and raised in Saik'uz territory and grew up here. I'm from the Grouse clan, and my mother is Cheryl Vandelaar and father Ken Vandelaar. My grandparents are Virginia George and Benny Teed, and then also on my father's side, Joan and Ben Vandelaar. Growing up, I didn't get much cultural, I didn't appreciate culture as much as I do now as an older adult and as a mother to a beautiful daughter, Chloe. So it's really a part of my lifelong journey to just immerse myself in my culture, learn that, and apply that to each part of my life. And that includes the work that I do within the community and the health center. So it really prides me to be able to share that and to deliver healthcare in an Indigenous way of knowing. And I hope that that's what I can do leading forward into the future. And I'm excited to be a part of Saik'uz health. In the last years, I've worked towards my bachelor's in nursing and successfully completed that and graduated last year. So I'm super grateful that I'm able to do that. I think that that degree and the knowledge that I've obtained in my education really gives me a basis to advocate for health services within Saik'uz and really know what the expectation for service providers and the relationship between Vanderhoof and other providers of services such as St. John's Hospital and Omnika Medical Clinic for our people. It really gives me perspective of what we should expect from them to serve our members and ensuring that we're getting the health care that we need for the people of Saik'uz. So I'm very excited to be an advocate for that and really build relationships and start to have more services within the community that we deserve as the people of Saik'uz. So I'm super happy about that I can do that for everyone. I wasn't here in the last physical, so I found it a little challenging to determine what kind of things happened within the last year as I wasn't here. So really today I'm just coming forward saying what kind of goals I want to obtain in the year to come, and really hear from the members what they want to see as well, and excited to host some engagement sessions to really hear the voice of Saik'uz and the people and what they need and the gaps that they see in healthcare that we can fill. So I'm really excited about that. Regina Thomas was the previous manager here, health manager, and some of the things that I was able to come up with the work that she's done is really the pandemic response with COVID-19. I think we've all felt that at many levels, and I'm sure everyone's happy today that we can move forward and start to immerse ourselves in our culture again and be with each other and be close with one another. I remember sitting in the Daketh beating circle and Maureen, who just delivered our prayer, she really just talked about the connection with our people and one another and not feeling the hurt of not being able to be connected. So really the goal is to reconnect and really meet the needs of the community members and hear voices and just be together and celebrate our culture and start with ceremonies and stuff, and I'm really excited about that. Some of the other work that Regina did is she continue to build relationships with First Nations Health Authority, with First Nations Health Directors Association and other platforms of which health care delivery comes from, Northern Health and Vanderhoof and other areas. She also found that there was a lack in some mental health services, so she was able to contract Ember of Hope Counseling and Training Services with Richard Sampson. I feel like the community has built a good relationship with Richard, and we hope to continue to have his services within the community. She's also made it possible for individuals to attend transformations, which is out of Prince George, and I'm hoping to continue that. And then she did day-to-day stuff with the health budget, with the running of the health center, with the services going through the health center, any emergency response services, and did a lot of work there too. But I can't really speak more than that to that, so I'll just leave that there. When I think of healthcare, I often think of a holistic approach to care. It doesn't only incorporate the physical, but it incorporates the mental, emotional, and spiritual part of health, which we as Indigenous people have always ensured in our healthcare in our delivery as our healers, not just to work on the physical, but every other component of health. And so when I think of the services coming into the community, I really think of that, and then that cultural aspect, and not just a Western way of knowing, but also an Indigenous way of knowing. And so incorporating that within the future healthcare delivery, and then also like a patient-centered approach where the person is at the middle of the care and we are providing wraparound services for that individual to meet the many needs that they might have, but also encouraging them to take a strength-based approach to their own health care, and that's through education and them having an awareness of what they should advocate for themselves. Because unfortunately we're not always there for everyone during the times that they may need us. So just really helping them understand what healthcare means and how you can advocate for that, and not taking no for an answer or not being pushed out of the healthcare, and really moving past what historically has been happening within healthcare with our people. So that's just my hopes, is to increase education around that, not only with our older adults, but our elders, our youth, and our children, because they're going to be alone in those situations and they need to be able to speak up for themselves and ask for what they need. So that's my hopes there. To say that I've been quite busy in the last month and a half is a bit of an understatement, because there's a lot of work that needed to be done, especially coming out of the pandemic. And so it's really just building a base underneath and really going from there to advocate for more services. With not only the pandemic with COVID-19, but there's the opioid crisis and the need for the mental health services within our community too. So I'm really just, those have been a priority. And we're really happy to have the Sacred Fire happening in the community on the Mondays with Mel, and she's doing really good work with the community and having conversations that aren't always easy. So I'm really happy to see that she's there and supporting members, and members are also supporting each other. So that's really great to see. Right now in the health center, there's limited space, and we have a lot of people starting to come into the health center now. We're missing, as far as staff retention, we don't have 2 NADAP workers, which we're working to obtain someone to fill those positions. We also don't have a janitor, so staff has been contributing with that. And then we also don't have a health assistant, so we're hoping to fill those positions and really allow those people to help with those services. I also I'm excited to hear the next presentation to come on, which is about the new health center, and Unison Architect is going to have a little bit of information to share with everyone through a video and show the designs, and I'm excited for that and hope that the work I do in the next bit is to prepare to enter into that health center in a good way, to ensure that the services that we have going there are consistent, and reliable, and that we can expect more when coming into that space, because there'll be a bigger space to allow more people to work within that space, and hopefully that will just continue to improve the overall health of the community. So I'm really excited about that. One of the things I've been working on with Mabel Louie is going and looking at culture, and how culture is one of the key components to Indigenous health, and how that intersects with many departments, many peoples in the community, our elders, our children, and many other aspects. But the program that we're hoping to develop, it's Saik'uz. It's the 4 seasons of the Saik'uz people. So Saik'uz, Daketh, Watan, Duhal, Netsi. I probably didn't say that the greatest, but the idea for this project is to have it as a year-round, almost like a cultural camp in some respect. And so this would run in the 4 seasons, where we would have sessions of engagement with culture, whether that be medicine gathering, harvesting and processing of that medicine, and then also fishing, hunting, berry picking, governance and understanding things like our potlatch system, ceremony, smudging, many things. So it's a really big program, and really pulls from every department to contribute to make it successful. So I'm excited to work with the other managers with this project and really start to revive and keep on that work with language and have that intersecting as well. So I'm really excited about that. And then we've started some groups within the health center. One that's been ongoing for quite a few months is the Daketh Beating Circle. We were fortunate to have Chimamuk from the BC CDC come to the community and provide some good engagement with like culture and like understanding how they can support our community and what we're doing, all the work we're doing already, and how to continue that work. So that has made a really big difference. And then my mom has really spearheaded the Daketh Beating Circle, having it every Tuesday night. We recently started the men's group up again, which is exciting for men's health and wellness. Travis has been spearheading that as well, with all the good work and volunteering he's done. And then we of course have our members like Maureen and Doris, and we have Vera coming, and all these people gathering, and it naturally just is healing, because we have language, we have culture, we have people talking, we have relationship building and many things. So that's part of healing, and it doesn't necessarily mean a pill. It means love and respect and many other things. So it's really good work that's happening within the community, and we hope to further that. Some of the ideas for these groups are outside of the women's and men's group is like a two-spirited group, so I hope someone can really champion that as well. A mom's group, hoping to engage with Vanderhoof and build that relationship, and having it not only in Vanderhoof but in Saik'uz as well. Family and children and youth, maybe some parenting and around the kitchen table again, and some drumming and dancing groups. I know Rosa and Cora have done amazing work in the past and hope to have them out again. And then elders gathering more and having elders tea luncheons and stuff like that. So I'm really, looking forward to that. In a political aspect of like building relationships, I've been already starting that work, talking with Vanderhoof, talking with the Omnika Medical Clinic, St. John's Hospital, and First Nations Health Authority, Carers Sikani, Family Services. So really trying to build up those relationships. I feel there's a need for that right now, of what I've seen. We have our health services delivery through Carers Sikani, so that relationship really needs to be better, I feel. I feel there needs to be better communication. I feel there needs to be the community's voice communicated to those services so we can allow them to improve. And excited to have more services coming through the health center. We also have a First Nations Health Authority dental hygienist that comes into our clinic. So I really want to encourage members to take advantage of that. In the last years, dental health coverage through First Nations Health Authority has improved, from my understanding, and you have more opportunity to have your teeth cleaned, and oral health is a really important component to your overall health. So just really want to encourage members to take advantage of her services. And then we have optometry coming in. We have like Caris County doing their diabetes clinics, and many other services. One of the things I tried to advocate more for is the related to the opioid crisis and having opioid antagonist therapy. I'm hoping to be certified so that I can prescribe in the future, as I can obtain that through my licensing, and then working with physicians to deliver that kind of program, not only in Saik'uz, but possibly looking to build that relationship between Vanderhoof. I feel there's a need for that because we've experienced a lot of loss across many nations related to this. So I really see there is a need within the North. And yeah, so I'm excited about that. And one other thing is, and it's not a light thing, it's the big thing, it's the prevention program that is going to be rolling out, and there'll be a discussion about that soon following this presentation with Mabel and Mary. And this program is very exciting. We have some new staff, so we have Claudia Johnny Martin, Ashley Antoine, and Shelby Hatley, and they are going to be doing a lot of work with the families, children, and implementing some programs within the community. And so just encourage you to keep your eyes out on the Facebook page to see the posts for future engagements and sessions, and also opportunities for some fun stuff as well. So there's lots of good work happening, and I'm excited to be in my role here, and I'm glad to have everyone welcome me so far. And I really want to invite everyone not to just talk amongst each other, but come to me directly, and I want to hear what you want to see for your health, what you want to see for your family's health in the community as well. I think that's important to have that voice heard, and I really just hope to just really get that from the community so I can do that in the future. Because I feel like before there might have been stuff that wasn't the best, so I just want to improve it from here and move forward in a good way. So I'm really thankful, and yeah, if you have any questions, I'd love to hear that, and Debay Masi.
This is Farshid Rafi from Unison Architecture. I'm the architect for the project, the Health Center, Saik'uz Health Center. Very honored to be here and assist Saik'uz First Nation. The project location is right on the Kenny Dam Road and intersection of Holmes. When you are entering the project, you enter into a cul-de-sac. There is a drop-off area, and people can park to the side. The entrance is right from this corner, so we have an overhang for the winter time. We have a little bit of a traditional garden here for the summertime. The building has a reception here, a community gathering place for a small gathering or for the meetings, and then the entire project included of offices, of practitioners, nurses, dental room, and little bit of a community kitchen here for serving food, and for the home care and tub and so on. We just received the expression of interest from 3 contractors, and one we are still waiting for them as we speak to confirm that. So with them would be 4, and if the band has other recommendations, it can be added to the list, and we can tender the project between them. We are ready for the tender, and move forward very quickly as soon as we have the permission from the band. In the old health center, what we noticed was the issue of the privacy between the rooms when the practitioners are there or the community members coming to visit. So on this design, we put a lot of effort and time, thanks to Regina and her team, and Vanessa, chief and counsel. We put a lot of time and effort to make sure that the flow is right and the privacy of visitors, we took it into consideration. And part of the building, if I can zoom in here, the front part is open to the public. We have a little bit of a waiting area. We have a community health room for meetings and so on, with a little bit of a kitchenette or a sink for the coffee. And we also have a little bit of a kitchen for the healthy food and for to potentially to be used after hours, for canning and for fishing and so on. This is the entrance of the building. When you come in at the drop-off area, the patient or the client can go inside the room from here. These are some renderings of this is the front again, this is the back of the building. And this is a little bit of peekaboo inside the reception area and gathering place. And to the left side is the community health room. So here is a view inside the community kitchen for canning and cleaning and so on. And this is another view toward the reception area and the entrance to this side. This view is inside the community health room and little kitchenette that we have to the left side. And again, we're back to the site plan. So all the drawings from architectural, structural, mechanical, electrical, all ready. Everything is ready to go for tendering. Again, this is Farshid Rafi from Unison Architecture, and my sincere apologies that I couldn't be there in person, and looking forward to assist Saik'uz First Nation to successful completion of this amazing project. Masicho.